dear learners, you're most welcome once again. I hope you're all doing well. So today we are going to look at a bed for patients with fractures. And before we start making a bed, it is a continuation of an unoccupied bed or a hospital bed or an empty bed. So before we go further, we have to look at the requirements on our trolley as usual. And at the top shelf, we need a long Macintosh, we need a bottom sheet, a drawer Macintosh, a drawer sheet, a top sheet, a blanket, and a counter pen. Then at the bottom shelf, we shall need a pillow, and at the bedside, we shall need a fracture board itself, and then we shall need a bed cradle. Not forgetting the screen for privacy, our 2 chairs for stripping off linen, and then a hand washing facility, of which we are going to use a hand wrap to sanitize our hands for infection prevention and control. So we are all aware that bed making is a 2 nurses procedure, and at this time, allow me to invite my colleague, Sister Frida. Yes, thank you so much. So as we are making a bed, remember the rules of bed making. Always stand in the middle of the bed, pull away the bed from the wall. However, we shall start by washing our hands. Make sure you sanitize very well. So in case the bed is having bed rails, you're going to pull them down. Okay. Then you pull the bed away from the wall, and then we check for firmness. So since we are making a bed for a patient with a fracture, we have to put our fracture board beneath the mattress to improve on the firmness. So after that, we are going to turn our mattress upside down. So make sure you straighten the mattress cover. And then we can spread our long Macintosh. After the long Macintosh, we go to the bottom linen or bottom sheet. So now we have to tuck in the top, and we meter the corner. We go to the bottom and do the same. Make sure your corner is looking neat, and after that, you tuck in the linen. Bottom sheet, we go to our drawer Macintosh, and you tuck in on the sides. Get your drawer sheet, spread it on the drawer Macintosh, and tuck it in at the sides as well. After that, you get your top linen, spread it on the bed. So we all remember that the top linen faces upside down, or the inside bees on the top. So for the top sheet, we only tuck in the bottom and we leave it hanging. We get our blanket, spread it on the bed. We still tuck in the bottom and meter the corner. You leave it hanging. You fold the top of the blanket to the center and fold the top of the top sheet to the center, making sure it is looking neat. So after that, we have to get our counter pen. But before the counter pen, in case the patient needs a pillow, we can provide a pillow for the patient. Making sure the open end doesn't face the door. So after that, we cover the bed with a counter pen. Make sure your linen is not touching the floor to reduce on cross-contamination. You tuck in the bottom and you meter the corner. You let it hanging. So in case there is no patient in bed, yes, we're going to get our bed cradle. Remember we said it is a bed for patients with a fracture. So if a patient is having a fracture on the rib, we get our bed cradle and put it where we expect the fracture. But for our case, the patient is not in bed, so we can just put it at the bedside. Hope that is clear. Thank you so much. After that, we put the bed back to the wall.